Greetings, Dr. Ben Malcolm, psychopharmacology consultant, psychedelic educator, and founder of the website spiritpharmacist.com here. In this video, I want to outline a little bit more about what's known about psychedelics, and particularly serotonergic psychedelics, and how they could interface with a condition called Raynaud syndrome. Let's go ahead and dive in. Before we get to that, I want to acknowledge Dr. Erica Bierbauer, who submitted a guest blog contribution on the subject that I went ahead and translated into this talk that I'm filming the video for you today about. And I also want to let you know that this presentation is really for educational purposes, informational purposes only, and I recommend that you follow the law. So let's go ahead and dive in. Before we do that, if you could do me a big favor, like this video, subscribe to this channel. That will help us continue to grow our audience and really inspire us to create more content for you. Thanks for doing that. So what is Raynaud syndrome? Raynaud syndrome is a vasospastic condition that tends to affect extremities like the fingers or toes. It is triggered by cold or emotional stress, and it's characterized by, particularly again, the fingers or toes turning white at earlier stages, blue as it progresses, and there's actual oxygen deprivation to the tissue as a result, a result of really poor circulation. And then at the end stages, it could become red overall. This is a relatively common condition with an incidence around 10%, and it's higher as far as a prevalence goes in colder climates and tends to affect persons that are younger or female opposed to other types of demographics or segments of the population. So there's a couple of different types of Raynaud syndrome that are recognized out there. There's a primary type, and then there's also a secondary type that tends to be linked with other types of conditions like autoimmune disease. There are many medications that could be relevant to Raynaud syndrome, as well as different types of drugs out there. And I would say that a lot of these aren't necessarily contraindicated in truly black and white type of ways, right? What we might think of in the world of pharmacy or pharmacology as black and white contraindications, or elements that just should never be mixed together because the risks are so high overall. But there are a number of medications that are known to cause or worsen Raynaud syndrome where there really should be a caution around using them. And I think a preparation to help manage Raynaud syndrome if it were to occur in a person that was trying these types of medications or substances for whatever types of uses or purposes. So some of them involve some of the migraine medications like the ergo-alkaloids or the calcitonin gene-related antagonists like the CGRP antagonists. Different types of stimulants, right, are known to cause vasoconstriction. Some different sympatholytic types of medications like clonidine or beta blockers can also lead to poor circulation in the extremities or worsening symptoms of Raynaud's syndrome. So the main mechanisms here, or the main sort of theme, are drugs that affect the vasculature through action at the sympathetic nervous system, right? Or maybe other parts of the autonomic nervous system. So if we're thinking about the ergo-alkaloids specifically, it's not necessarily through things like adrenergic receptors, but it is through serotonin-related receptors, right? So if we're thinking about psychedelics, they share some of these mechanisms, which is really the reason that we decided to put this video together. So the stimulants do increase catecholamines, which can lead to excessive vasoconstriction, particularly in the capillary beds of the extremities where persons are really affected with Raynaud's syndrome. And there are some also reports with other types of patient demographics or pediatric patients, smaller children, that are using stimulants like the ADHD medication. So things like amphetamine, Adderall, or methylphenidate Ritalin are the two big primary brand names in the world of stimulants. So what types of mechanisms do psychedelic substances have that are truly relevant to mechanism of Raynaud syndrome, right? So you have tryptamines, and the tryptamines are particularly things like psilocybin, psilocin, or DMT, N-dimethyltryptamine. Some other examples involve other substances like 5-MeO-DMT or 5-methoxy-dimethyltryptamine. And I would say that LSD is not technically a tryptamine. It is actually an ergo-derived medication, or ergotamine, although you might think of it from a medicinal chemistry perspective as a rigidified tryptamine, because you can really trace a tryptamine backbone within its larger ring type of structure. And so on the previous slide, I mentioned that some of the migraine medications that actually were ergo alkaloids were known to cause or exacerbate Raynaud syndrome. So it probably isn't a huge stretch to think that psychedelics that also have activity at the same types of serotonin receptors, particularly ergo-related ones perhaps. There's lots of analogs of LSD out there as well that are lesser known but oftentimes used as substitutes, really could have potential to worsen Raynaud syndrome. And so a lot of these types of drugs or substances also bind directly with dopaminergic or alpha adrenergic types of receptors, as well as cause, again, the vasoconstriction via stimulation of serotonin, particularly serotonin 2A types of receptors. Some psychedelics have action at serotonergic neurons, but they are also technically stimulant types of medication. So things like MDMA, or 3,4-methylene-deoxymethamphetamine, has the ability to cause both amphetamine or stimulant as well as serotonergic vasoconstrictive types of effects. So again, you can really see that there's a true overlap between the mechanisms of many different types of serotonergic psychedelics and drugs that are known to cause or worsen Raynaud syndrome. So what's the sort of evidence base out there? In putting this blog and video together, we did a literature search to see if we could find true cases within medical literature of persons that have reported episodes or exacerbation or worsening of Raynaud syndrome in response to psychedelic use, and we really came up short there. So I don't want to be too alarmist about this subject, because I think that if it was a really common thing, if it really affected people severely, we probably could have found a little bit more evidence within the primary medical literature about it. We could find some different threads in places like Reddit, Blue Light Forum, where persons were talking about how serotonergic psychedelics had led to some level of vasoconstriction, coldness in the extremities. Some people, interestingly, with things like MDMA, noticed an acute improvement in Raynaud's syndrome, but noticed some flares or worsening of Raynaud syndrome in the days to weeks after use. Again, not a smoking gun there, but the person had noticed this type of association for themselves. So I think that we could probably say something along the lines of psychedelics really might have the vasoconstrictive mechanisms and or be considered, although there's a lot of ongoing research and therapeutic promise in psychedelics as far as being able to help persons with different types of psychiatric conditions, particularly, you really could see drug use as causing some kind of stress upon the body. There could be a large sort of emotional upheaval that comes along with psychedelic use. The substances are well known to essentially trigger or cause those types of things for persons. That could be part of its therapeutic mechanism, but it also could be seen as a stress upon the body or the system or the psychology in some ways, to the point that you might want to approach psychedelics cautiously, particularly if you know you're affected with this condition at baseline. And so some things that you could do if you are considering to engage with psychedelics would be to stay warm, to maybe bring some sort of hand warmers, hot packs, have access to warm running water. If an episode of Raynaud's occurred, you could use those types of hot packs, run them under hot water, hands under hot water, feet dipped in hot water, if it really was affecting you. I would say you also have to be cautious about immersing yourself in hot environments like jacuzzis and hot tubs when you're under the influence of psychedelics. Sometimes they can cause a loosening of the body's thermostat, and you can be more susceptible to increased core body temperatures, and that can actually pose some risks with psychedelics if you're exposed for too long of a periods. But I would say if you're experiencing worsened vasoconstriction to the point that your fingers or toes are numb, white, cold, maybe even blue, right? That would be much more concerning. Then you really would want to go ahead and particularly run them under hot water. Use some of those little hot packs. You can get them for camping, stay warm at night, things like that. Maybe consider having some blankets, other layers that you could bring to help in that regard as well. So to summarize and conclude this video, Raynaud syndrome, again, involves an exaggerated vasoconstriction triggered by cold or emotional stress. There are several medication classes that are known to worsen Raynaud syndrome or considered to be at least relative types of contraindications for persons that have Raynaud syndrome, and there's a lot of mechanistic overlap between those types of medications and different types of serotonergic psychedelics. And there's multiple mechanisms of serotonergic psychedelics like vasoconstriction through serotonin 2A, dopamine, as well as alpha adrenergic receptors that could lead to worsening episodes or cause episodes of Raynaud syndrome. And using things like warmth, taking psychedelics in controlled types of environments, having some hot packs or the ability to access hot water on hand if episodes of Raynaud syndrome did occur could be some harm reduction mechanisms if the individual was still choosing to engage for whatever types of reasons or purposes. If you found this video helpful, if you feel the content had value, a reminder to go ahead to like the video, subscribe to the channel, and be sure to check out the links below. Head over to spiritpharmacist.com where you can learn more and access full-length comprehensive courses that detail the therapeutic potential of psychedelics, their pharmacology, as well as their drug interactions with a variety of different types of compounds, substances that persons are likely to be taking when they're approaching their use overall. Till next time, take care, stay safe, and be well.